Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and I'm going to be going over the endocrine system. Endocrine system is very large, so this is going to be part one of a multi-part series. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video, give it a thumbs up, press that red notification bell so you'll be notified every time a new video is released, and please subscribe to my channel if you haven't done so already. Also, don't forget, I'm now offering next generation NCLEX prep course. It's a very quick course. I'm giving you the basics of the type of questions you should expect to see, how to answer those type of questions, important concepts that you need to know to pass your test. So if you're studying for boards, be sure to check that out. And I also have audio lessons available. You can book for the review. You can get your audio lessons on my website, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Endocrine, part one. Which gland is responsible for increasing glucose, for suppressing inflammation, sodium retention, and potassium excretion? Which gland is it? Is it the adrenal cortex, the intestines, the ovaries, or the pancreas? Okay, the correct answer is adrenal cortex. You guys are so smart. So the ones who got it wrong, at least you chose another gland that's part of the endocrine gland, which is the pancreas. But no, it's the adrenal cortex. Look at what the question's asking. Let me move this down. Gland that's responsible for increasing glucose. Let's stop right here. Increasing glucose. Those who chose pancreas, well, think about it. When we think about the pancreas, right? What is one of the functions of the pancreas? Well, over in the beta cells, in the islets of Langerhans of the pancreas, that's where insulin's made. If anything, insulin does what? It decreases the blood glucose, not increases blood glucose. So why would you choose the pancreas, right? It says responsible for increasing glucose, suppressing inflammation, for sodium retention and potassium excretion, and we're talking about the adrenal cortex. So if you take your, can you see? Yeah, if you take your two hands and put them behind your back, right where your palms are, that's kind of where your kidneys sit. And the adrenal glands are the glands that sit right above your kidneys. You have the adrenal cortex, which is a more outside part, and the adrenal the medulla, which is the inside part. The adrenal cortex, that's what answers this question. You guys know that the intestines are important for, that's your GI tract. The ovaries, female reproductive system, and of course the pancreas. I just explained that, one of the functions to you. Select all that applies. Name two posterior pituitary disorders. Name two. Cushing's disease, SIADH, diabetes insipidus, diabetes mellitus. Choose two posterior pituitary disorders. Remember, you're choosing two, guys. Everyone on the live, if you couldn't make it to the Kahoot, you can still join. Type in the color you're answering. Okay, and the correct answer, guys, is your SIADH and diabetes insipidus. Okay, so in the posterior pituitary gland, you only have those two hormones. You have antidiuretic hormone, right? And you have vasopressin. Those two, no, yeah, antidiuretic hormone and vasopressin, oxytocin. You have those two, ADH and oxytocin. Everything else is in the anterior pituitary. So Cushing's disease, this is an adrenal disorder, right? What are our other choices? Look at this. Diabetes mellitus, not to be confused with diabetes insipidus. Diabetes mellitus has to do with blood glucose. Now your SIADH, which was a correct answer, SIADH. Remember I talked to you guys about antidiuretic hormone. When you have too much antidiuretic hormone, you have this SIADH and you're holding on to all of your fluids. You can have water intoxication among other complications, right? But when you don't have enough antidiuretic hormone, you don't have enough ADH, you can have this diabetes insipidus, not to be confused with diabetes mellitus. Diabetes insipidus, where the patient is urinating all over the place. Now, very quickly, before we move on to the next screen, I want to explain these two for you because you guys tend to get this wrong all the time on questions. So let me make this clear. SIADH, that's when the patient, that's SIADH stands for syndrome of inappropriate antidiuretic hormone. The patient has way too much ADH. They're holding on to all of their fluids. So what happens is they're holding on to all their fluids, but the little bit of fluids that they do let go of in the urine are full of solutes, right? So even though the urine output is down, the urine specific gravity is up, right? Follow me here. So the urine output is down and the urine specific gravity is up because all of the solutes that were in the blood are spilling out into the little bit of urine that the patient's letting go. What do you think that patient's serum osmolality is going to be like? What do you think their blood is going to be like? The osmolality in the blood is going to be low. Why? All of the solutes that were hanging out in the blood went to the urine. So in SIADH, urine is going to be down. Urine output is down. Urine osmolality is up. And the serum osmolality is what? Down. Okay. All right. Diabetes insipidus. Diabetes insipidus is the opposite. The patient does not have enough antidiuretic hormone, so they're urinating all over the place. So the numbers are going to go the opposite way. The urine output is going to be up, right? That patient's urinating all over the place. Now, even though they're urinating a lot, guess what? The solutes are staying in the blood. So even though urine output is up, guess what? The urine specific gravity is down because all those solutes stayed in the blood. So what do you think the serum osmolality is going to look like? It's going to be increased because those solutes stayed in the blood and did not go out into the urine. So those are the biggest differences between your SIADH and your diabetes insipidus. Don't say I didn't warn you. Select all that apply. What are the classic characteristics of diabetes insipidus? Select all that apply. Excessive release of antidiuretic hormone, dilute urine, excessive urination, dehydration, decreased urine-specific gravity, decreased serum osmolarity. And you better all get it right. I just explained to you what's going on. I left my drink over there. I'll be back, guys. You guys are quiet on the live. Are you thinking? Okay. Let's go over this. So the classic characteristics of diabetes insipidus. Remember, in diabetes insipidus, the patient's urinating all over the place because they don't have enough ADH. Correct answer. Dilute urine. Yep. Even though they're urinating all over the place, that urine is dilute. The specific gravity is low. Why? All of the solutes stayed in the bloodstream. Excessive urination. Yes, because they don't have enough ADH, antidiuretic hormone. Dehydration, yes, because they're urinating all over the place. They are losing all of their fluids. Decrease urine-specific gravity, yep, because even though they're urinating all over the place, all of those solutes stayed where? In the bloodstream. Let's look at the wrong answer. Excessive release of ADH. What is that? That's diabetes insipidus. SIADH, excuse me, I can't think. That's SIADH. When you have too much antidiuretic hormone, that's SIADH. You're holding on to all of your fluids when you have too much ADH, right? And the other wrong answer was decrease urine osmolarity. That's also SIADH. Remember in SIADH, the patient is holding on to all their urine. They're holding on to all the urine, and the little bit of urine that they let go of is full of what? Solutes. All of those solutes that should have been in the blood is in the urine. So what does the serum, what does the blood osmolality look like? It's going to be decreased. So these two wrong answers, they go with SIADH, while the correct answers go with diabetes insipidus. I know it's confusing, but guys, you just really have to think about the pathology, and it's going to make sense to you. But you got to take your time thinking about it, because I'm seasoned. I've been doing this for years, and I still will trip myself up if I'm talking too fast. Select all that applies. What are the classic symptoms of SIADH? Select all that apply. Excessive urination, fluid retention, dilution of blood elements, increased urine-specific gravity, fluid balance abnormalities, decreased urination. What do you guys think? Okay, so let's talk about this. Remember, in SIADH, the patient has way too much antidiuretic hormones, so they're holding on to all their fluids. So let's look at the correct answer. Fluid retention, yep, they're holding on to all their fluids. Dilution of blood elements, absolutely, because even though they're holding on to all their fluids, the tiny little bit of urine that they do release are full of the blood solutes. So the blood elements are going to be very diluted. That's right. They're not going to be thick. Increase urine specific gravity. Yes. Why is the specific gravity of the urine increased? Because all the solutes that were supposed to be in the blood is in the urine. Fluid balance abnormalities. Well, of course, the patient's holding on to all their fluids. Of course, they're going to have fluid and electrolyte abnormalities. And decrease urination. Yep, decrease urination because they're holding on to all of their fluids. The only wrong answer here is excessive urination. We don't see excessive urination in SIADH. We see excessive urination in DI, diabetes insipidus. And I saw a couple students in the comment section for DI, diabetes insipidus, they wrote, think D for dry, I for inside. When the patient has DI, they're dry inside because they're urinating so much, they're losing all their fluids, okay? What is known as the master gland of the neuroendocrine system? Is it the anterior pituitary gland? Is it the posterior pituitary gland? Is it the hypothalamus? Is it oxytocin? All right, guys. So it's the hypothalamus. The hypothalamus is the control center for the neuroendocrine system. All right. Most of your hormones are located in your anterior pituitary, except for two. In the posterior pituitary, again, you have your oxytocin, you have your antidiuretic hormone, and then oxytocin, that is a hormone that causes uterine contraction, contraction of the smooth muscle, and it can also cause contraction of it can cause the woman who has the breast milk for to be able to express the breast milk. Okay, that contraction can help express the breast milk and contraction of the uterus, I should say. Select all that applies. Which hormones are not found in the anterior pituitary? Select all that apply. Guys, I gave you the answer like 3 times already. Select all that apply. Is it growth hormone, prolactin, thyroid stimulating hormone, antidiuretic hormone, oxytocin, or adrenocorticotropic hormone? What do you guys say? Everyone should get this right if you've been paying attention. Okay, so let's go over these answers. And the 2 correct answers, guys, are very good. Is your antidiuretic hormone, your ADH, that's what makes you hold on to your fluids, and your oxytocin, again, that's what causes the uterine contractions, so the mother can expel the fetus out of her womb, right? And also so she can actually breastfeed the baby. All of the other choices, guys, are found in the anterior pituitary. Which hormone causes thickening of the bones after the epiphyseal plate has closed? Is it excess growth hormone, deficiency of growth hormone, excess ADH, deficiency of ADH? Is it excess oxytocin or deficiency of oxytocin? Okay. Excess growth hormone. And I even gave you guys a little hint in the picture. If you look at the picture, it said acromegaly. So I think I talked about this in one of my previous videos as well. When the epiphyseal plate has closed, that's that growth plate, right? And the patient has increased growth hormone. What happens is they're not going to get any taller. That growth plate has closed. So it's not like they're going to get taller. What happens is the bone gets thicker, very chunky. The patient has what's known as acromegaly. Now, if the patient has too much growth hormone, but the epiphyseal plate has not closed yet, that growth plate has not closed yet, that can cause the person to be taller. So what happens is when it's a child or an adolescent and that epiphyseal plate hasn't closed yet, they can get a synthetic form of growth hormone and they'll grow taller. But once that growth plate has closed, they have to stop getting that medication, because if they keep taking it, all that's going to happen is they're going to get acromegaly. They are not going to get taller. So the correct answer, guys, is excess growth hormone, because look at what it says. It says after the epiphyseal plate has closed. Which medication is used for the treatment of children with growth failure due to lack of growth hormone or renal failure? What medication? We just talked about this. Remember how I told you they'll get a synthetic form? Well, what is that synthetic form of growth hormone that children can get if their growth plate has not closed yet? Is it Parladel, somatulin depot, sandostatin, or somatotropin? Very good. It's somatotropin. And some very important things about this medication you guys have to be aware of. Number one, that child has to agree to get that medication, because this medication is given by injections. So they have to agree to these multiple injections. And this is where ethics gets involved. And I've seen a lot of endocrinologists and a lot of healthcare professionals really get in trouble with the law. Okay, so you got to be careful if you're working in that field. The child has to be okay with getting these multiple injections. Another thing, and these injections, they're painful. Something else you got to know, you got to teach the parents or the caregiver, whoever's giving the injections, you got to teach them about rotating the injection sites, because if they keep getting the injection in the same place, it's going to cause that tissue to harden, and then it's going to decrease absorption. You got to teach the person who's giving the injection how to reconstitute, how to prepare the medication. You got to teach them how to store the medication. It has to be refrigerated. So there are a lot of important teachings that come with this medication. So make sure that you guys are aware of that. True or false? X-ray should be taken to monitor for closure of the epiphysis, because if that happens, somatotropin should be stopped. True or false? And I accidentally gave you guys the answer to this when I was explaining something else. Everyone should get this correct. X-ray should be taken to monitor for closure of the epiphysis, because if that happens, somatotropin should be stopped. Is that true or is that false? Very good. That is true. If the epiphyseal plate has closed, if that growth plate has closed and that patient is still getting this medication, it is going to cause acromegaly. Select all that applies. What teaching should you provide regarding growth hormone? Select all that apply. Oh, I didn't know that was a question. I forgot. It should be, let me move this for you guys. It should be taken by mouth. The injection sites should be rotated. Sterile technique should be used for drug administration. The drug should be refrigerated. It's not necessary to monitor X-ray results. Monitor the patient's response to the drug. This is a select all that applies, so make sure you treat it as true or false to get it correct, as long as you know the answer. But you increase your chances of getting correctly when you use the true or false method for select all that applies. Okay, so it should be taken by mouth. No, I just explained to you that it's given by injection, so we know that's not right. Injection should be rotated. Absolutely. Sterile techniques should be used. Absolutely. We don't want to take any chances of introducing any pathogens to the patient. The drug should be refrigerated. Yep, that's how it's stored. X-ray is not necessary. X-ray is not necessary to monitor. It is not necessary to monitor X-ray results. That is false. Before they're started on that medication, we're going to take an X-ray. We're going to make sure that plate has not closed, and that patient's going to get serial X-rays throughout therapy, because once that growth plate's closed, they can't get the medication anymore. That's number one. And number two, we need to make sure that this medication is being effective and doing what it's supposed to be doing. Last, monitor the patient's response to the drug. Absolutely. You're going to have to be taking their height, right? If this medication is one of the teaching, you're going to tell the parent or caregiver, if you notice your child's not growing, you need to let us know right away. True or false? Antidiuretic hormone, ADH, is also known as vasopressin. True or false? True. Vasopressin, when you see vasopressin, they're talking about ADH and vice versa. Remember, there's only two hormones we find in the posterior pituitary. It's your ADH, also known as vasopressin, and your oxytocin. True or false? The only ADH medication available is desmopressin, DDAVP, Stymate. Is that true or false? The only ADH medication available is desmopressin. True. That is the only medication that's available on the market for ADH, to be given for ADH, desmopressin. Select all that applies. What are the adverse effects of desmopressin? What are the adverse effects? Water intoxication, hangover effects such as tremors, sweating, vertigo, headache, nausea, vomiting, abdominal cramps, local nasal irritation. What do you guys say? I see you guys on the live. You're doing a great job. Keep going. All of them. All of these are adverse effects of desmopressin that you guys have to be aware of. Okay. Remember, when we're talking about desmopressin, what do we really talk about? Antidiuretic hormone. It's making you hold on to all your fluids. The patient can have water intoxication. That can cause a hangover effect where the patient will display tremor, sweating, vertigo, headache, nausea, vomiting. They can have abdominal cramps and local nasal irritation. And here's what's so weird. Only 6 of you guys got this correct with the local nasal irritation, where I gave you guys a hint in the picture. If you looked at that medication, desmopressin, how was it given? In the nasal form. How did only 6 of you guys get it right? Come on, guys. Select all that applies. Desmopressin is available in which form? Select all that apply. How can desmopressin be given? Remember, desmopressin, we're talking about the ADH. What are all the forms that it can be given? Orally, intramuscularly, intravenously, subcutaneously, nasally, by inhalation, rectally. What are all the forms that desmopressin can be given? I know you guys are just cheating, looking at the picture. Mm-hmm. That's okay. As long as you guys remember this for your test, I'm fine. Okay. It cannot be given orally. It cannot be given intramuscularly, but it can be given IV, sub-Q in the fatty area, nasal administration, these 3 right here. It cannot be given rectally. Sub-Q, IV, or nasally. Last question. What is used to treat SIADH? Is it vasopressin blockers? Is it growth hormone? Is it estrogen, or is it testosterone? What is used to treat SIADH? Wonderful. Most of you guys got this right, of course. If we're treating SIADH where the patient has too much antidiuretic hormone, are we going to give something to block it? Vasopressin blockers. You know that growth hormone makes the bones grow unless that plate's closed and it just get thick. Estrogen, that's the woman hormone. Testosterone is the male hormone. So the correct answer is vasopressin. You guys did a wonderful job. All right, guys, thank you so much for watching. Thank you for being a part of this. Please, in the comment section, let me know what you thought of this video. Let me know of any new content you'd like to see me cover, or if there's something I covered already, but you'd like to see me cover it more extensively, or maybe you don't want to see it in a Kahoot format. Maybe you want to see it in a lecture format, or even in the format of the questions that those videos where I do every Sunday at 1:00 p.m. Eastern Standard Time that are released in question form. In any format, let me know what you'd like to see me cover and how you'd like to see me cover it. Again, guys, don't forget to check out my website, nexusnursinginstitute.com, for NCLEX review, audio lessons, and don't forget, almost daily, you guys can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much. Thank you so much for watching, and you guys will catch me on the next video.